The pudendal nerve in the pelvis is just like any other nerve in the human body, in that it can become compressed, resulting in pain and dysfunction of the nerve, just like in carpal tunnel syndrome. This compression can be from scar tissue and other causes. The pudendal nerve is the main nerve in the pelvis, which affects a lot of motor and sensory functions of your organs in your pelvis and lower abdomen. The pudendal nerve can cause pain in the perineum and its branches to many different superficial and deep areas of the perineum. There are many causes and areas of compression, so finding the exact cause and entrapment location is important. This video is going to talk about pudendal nerve entrapment, pudendal neuralgia, most but not all of the causes of this medical condition, most but not all of the areas of compression of the pudendal nerve, many of which have been discovered by many leading surgeons and doctors, as well as some other conditions that mimic pudendal neuralgia, or can also occur in addition to pudendal neuralgia. I'll also talk about all of the physical effects, emotional effects, how to get help, and how to spread awareness about this medical condition to the public and to the medical community. For too long, this has been a gray area of medicine, but in my opinion, it shouldn't be. And I don't know why it is, but it is. The pudendal nerve, can be compressed just like any other nerve in the body. And my hopes in doing these videos is to bring awareness to the medical community about the pudendal nerve, to familiarize them with this, all the branches of it, all the functions of it, and the fact that it can be compressed, just like carpal tunnel syndrome, tarsal tunnel syndrome, trigeminal neuralgia. There's many different areas of the body where a nerve can be compressed. And depending on each site of compression of a nerve will cause different physical problems from that compression of the nerve. If you have trigeminal neuralgia, you'll have facial pain. If you have carpal tunnel syndrome from compression of the nerve there, you'll have, pain in your wrist or your hand. The pudendal nerve is no different. If you have compression of the pudendal nerve from a surgery, injury, from scar tissue, or any other abnormality, you can have physical effects from this, because your pudendal nerve affects many different functions in your pelvis: your urinary functions, your sexual functions, your bowel movement functions, and also sensory functions in your perineum, which causes extreme pain in that area. All the areas innervated and affected by the branches of the pudendal nerve. So this, in hopes of this, the hopes of this basically is to bring awareness to the medical community, to medical schools, to medical students, and to hopefully bring about more surgeons, more doctors that are aware of this, better treatment, better surgeries, better success rates, better methods of diagnosis, improvements in all these things. But most importantly, bring more awareness to this, because there really is a lack of awareness of this, and it's time for it to change. Also, always consult your doctor about any medical condition you may have, and any information given on here does not substitute for that of your doctor or specialist. In my opinion, pudendal neuralgia and pudendal nerve entrapment are extremely misdiagnosed and underdiagnosed medical problems that are the root cause of pelvic pain in many people in the world. and are often the cause when doctors cannot figure out what is wrong for sure with the patient who actually has pudendal neuralgia or pudendal nerve entrapment, despite after doing all tests and ruling everything out. Even after doing all tests, it is sometimes labeled as or misdiagnosed as other conditions such as IC, chronic non-bacterial prostatitis, chronic pelvic pain syndrome, vulvodynia, vestibulitis, prostatinia, idiopathic vulvodynia, idiopathic orchialgia, idiopathic proctalgia, idiopathic penile pain, coccydynia, levator-ani syndrome, and for those with pain at the ischial tuberosities as ischial bursitis and more, including pelvic floor dysfunction, and that's actually can be a symptom caused by pudendal neuralgia and the urinary problems associated with it. Idiopathic means unknown cause. Some of these are diagnoses which are given to explain a symptom and not the cause. Some of these are actually caused by problems other than the pudendal nerve itself. So testing should be done for these other problems, but once those other problems are ruled out by doctors, then pudendal neuralgia and pudendal nerve entrapment should be considered a possibility. There's some common causes of pudendal neuralgia and pudendal nerve entrapment. One is from weightlifting or sports injuries. Two is bicycling. Three, there's many kinds of surgeries done in the pelvis or abdomen, which you can cause it. Four is from hysterectomies. Five is from childbirth. Six is from an instant minor or major trauma or fall or injury. Seven is from exercising. Eight is from an unknown cause. Nine is from repetitive minor traumas or injuries. 10 is from previous infections. There are many possible causes and areas of compression of the pudendal nerve or pudendal neuralgia. Here is a list of most of the areas and causes of pudendal nerve compression, entrapment, and neuralgia, which I've researched and found from many leading surgeons, doctors, and other resources so far. Number one, compression of the pudendal nerve by fibrosis or scar tissue of part of the sacrospinous ligament, Dr. Eric Bertrand, France. Number two, compression of the pudendal nerve by scar tissue in the Alcock's canal, Dr. Eric Bertrand, France. Number three, compression of the pudendal nerve by spine or sacral area, lumbar spine disc area or sacral disc area. Number four, compression of the pudendal nerve by piriformis muscle abnormality or piriformis muscle syndrome, Dr. Eric Bishop, France. Number five, compression of the pudendal nerve by fascias of the muscle obturatus internus, which constitutes the Alcock's pudendal canal, Dr. Eric Bishop, France. Number six, compression of the pudendal nerve by being too close, in other words, too tight a space between the sacrotuberous and the sacrospinous ligaments, Dr. Eric Bishop, France. Number seven, compression from a dysfunctional state of the piriformis muscle can generate a repeated hypertension of the muscle with hypertrophia. If it has a consequence of the bony structure, it can close the interligamentory grip in which the pudendal nerve passes. The pudendal nerve is already weakened at the level of the intrapiriformis. This is from Guy de Bishop's Pierres. Number eight, compression of pudendal nerve at the area of the pubic ramus tunnel, also known as the area of the dorsal branch of the pudendal nerve. Dr. Lee Dellin and also Dr. Oscar Osman. Number 9, compression of the pudendal nerve at the perineal branch of the pudendal nerve, Dr. Eric Bertrand. Number 10, compression of the pudendal nerve at the rectal branch of pudendal nerve. Number 11, compression of the pudendal nerve by scar tissue surrounding any area of the main pudendal nerve or its branches. Number 12, compression of the pudendal nerve can be caused by pregnancy, scarring due to surgery, accidents, and surgical mishaps, Wikipedia. 13, compression of the pudendal nerve can be caused by anatomic abnormalities and can result in PNE due to the pudendal nerve being fused to different parts of the anatomy, Wikipedia. Compression of pudendal nerve by being trapped between the sacrotuberous and sacrospinous ligaments, Wikipedia. Number 15, compression of the pudendal nerve by activities such as bicycling, causing a thickening of the sacrotuberous and or sacrospinous ligaments and trap the nerves between them, resulting in PNE, Wikipedia. Number 16, compression of the pudendal nerve as it passes under the piriformis muscle. That's nervemed.com. Number 17, compression of the pudendal nerve as it travels across the obturator foramen within the Alcock's canal, nervemed.com. Compression of the pudendal nerve by irritation of the impar ganglion on the internal surface of the cocks, nervemed.com. Compression of the pudendal nerve upon exit from the Alcock's canal, and branching in the perineal area, which is where my worst pain is, and where I'm actually compressing the perineal and the dorsal branch of the pudendal nerve. That source was from nervemed.com. Number 20, compression of the pudendal nerve by sacroiliac joint dysfunction, which I know some people that this has been the cause of, and for that case, physical therapy is the best treatment for that. I personally know someone who had it for 37 years and finally got the right diagnosis of sacroiliac joint dysfunction and was finally gotten on the road to getting better now. Anyways, this source said, clinically we have observed that symptoms of pudendal neuralgia are often associated with sacroiliac joint dysfunctions. We propose that the pudendal nerve could be compromised by dysfunction of the sacroiliac joint. Potential mechanisms could involve soft tissue damage resulting in stiffening of fibrotic scar tissue at the sacroiliac joint, causing sacroiliac joint malalignment. The putative reasoning suggests that if physical stress causes the sacrum to nudate or the ilium to posteriorly rotate, tension is placed on the nerve as it moves between the sacrospinous and the sacrotuberous ligaments. The suggestion is that the sacrospinous ligament squeezes the pudendal nerve against the sacrotuberous ligament, causing sensitized and inappropriate pain patterns. And this is from a physiotherapist, Peter Dornan. His website is peterdornanphysio.com.au. And this is something that people can be tested for pretty easily, sacroiliac joint dysfunction, by someone who's trained sacroiliac joint dysfunction by performing physical exams. So, I think a stand-up MRI might also help in diagnosing it. But, this is one cause that can be ruled out with these different ways. But this is just one of the different causes of pudendal nerve compression, and it's I'm not saying this is one of the main ones, but this is just one area. All right, number 21. Of particular interest, one perineal branch of the nerve, the inferior pudendal branch, which is the long scrotal nerve, curves below and in front of the ischial tuberosity, pierces the fascia lata and runs to the skin of the scrotum in the male, and in the female it would run to the labium majus So in the male, it would cause scrotal pain, and in the female, cause labial pain. As being one of the consistent symptoms of this condition. That's also from Peter Dornan, peterdornanphysio.com.au. Number 22, several of the lumbar nerves, in particular the posterior femoral cutaneous nerve, inferior gluteal nerve, the tibial medial popliteal nerve, the common peroneal lateral popliteal nerve, and the perforating cutaneous nerve derive at least one slip from S2, S3, or S4. The patient may also complain of pain in the lower back, groin, buttocks, posterior thigh, calf, or ankle. This may be referred either by neural convergence by direct injury to the lumbar area or by chronic SIJ, sacroiliac joint damage, impacting on L5-S1, thereby interfering with local emitting lumbar nerves. Given the wide range of innervation of the SIJ and its adjacent neural structures, SIJ capsular stimulation may refer various pain patterns to the buttock, groin, thigh, calf, or foot. That's from Peter Dornan, also peterdornanphysio.com.au. 24, another cause is different kinds of autoimmune disorders, possibly multiple sclerosis or other ones. Number 25, nerve compression by varices, which are enlarged veins on the nerve. Dr. Osman in Austria and also Dr. Passover in Switzerland. Dr. Osman has confirmed 2 cases of this occurrence and findings through surgery that he has done. Although, varices may or may not be a more rare cause of the branch of the pudendal nerve to be compressed, it has been confirmed by surgery with these 2 surgeons. Having said that, it's always best to let the nerve surgeon handle the varices in these areas so close to the nerves. And Dr. Osman recommends ligation resection if he finds it to be the cause. Other methods in the past that have been tried to remove the varices to decompress the pudendal nerve have proven unsuccessful in this area, which is another nerve for varices in the pelvis is called pelvic venous congestion syndrome. Anyways, these other methods to remove the varices called embolization and sclerosing of the varices have proven unsuccessful in most cases in the past. So it's usually best to let a pudendal nerve entrapment, a nerve surgeon take care of the varices in these particular areas, especially because it could actually be a compression of the nerve itself, which in turn is causing the actual varices or enlarged veins. Basically, whenever you have any kind of nerve compression, your blood vessels are right there alongside your nerves in the same path, like in a tunnel, basically. So, because your blood supplies the nerve for it to function. So, if you think of it like this, if you fill up a balloon with water and then you squeeze it at a certain point, it's going to cause that other part of the balloon to dilate and balloon and to enlarge. So the same is the case with this. So if you have a compression of a nerve, the vein which is right there along with it will basically balloon out or dilate, which is the name varices. Sclerosing of the varices could also potentially cause more scar tissue, which is why Dr. Osman and Dr. Dallin and other surgeons specialize in decompressing the nerve In most cases, do not recommend that. Instead, ligation or resection is what they recommend. Um, there's also other nerve pains in the pelvis that can mimic pudendal neuralgia or pudendal nerve entrapment, or are also very similar to pudendal neuralgia and pudendal nerve entrapment, and also other nerve pains that you can have in addition to having pudendal neuralgia or pudendal nerve compression. Because whatever caused your original injury uh, or scar tissue, whether it be surgery or trauma, you know, it makes sense, can also, cause scar tissue or compression of a nearby nerve, since there's, nerves that are very close by to the pudendal nerve, since it is a nerve that goes through a long pelvis, and there's other nearby nerves, which is this is what I'm going to discuss now. Number one, you can have a compression of the cluneal nerve, um, which is actually a branch of the posterior femoral nerve, um, and this cluneal nerve branch can cause you to have pain in your buttocks, because the cluneal nerve goes to your cutaneous skin area of your buttocks. So if you have a nerve compressed in your cluneal nerve branch of the posterior femoral nerve, then you can have pain in your buttocks area. And Dr. Lee Dellin in Baltimore is one who does decompression of the cluneal nerve. You can also have, number two, a compression of the genital femoral nerve, which part of that actually goes along the psoas muscle and then branches into the genital area and also to the femoral or the thigh area. Number three, there's also many other nerves in the pelvis close to the pudendal nerve that can cause other pelvic nerve problems, such as the ilioinguinal nerve, iliohypogastric nerve, obturator nerve, lateral femoral cutaneous nerve, etc. These are other ones that you may have in addition to your pudendal nerve entrapment or neuralgia, or could also kind of mimic it and make it hard to diagnose. So it's important to get the right diagnosis. Number four, it's possible to have both the pudendal nerve and a totally different nerve, and totally separate nerve compressed at the same time, which I mentioned again by the initial injury, surgery, or what caused it, such as having a compression of another branch of your pudendal nerve, or multiple branches, like have a compression in your dorsal branch of the pudendal nerve, and also have a compression of your perineal branch of the pudendal nerve, which requires a separate surgery, different surgical approach than the traditional TG approach to access, which the TG approaches different areas, such as the posterior Alcock's canal and some of the rectal branches. So that's why it's important to make sure you get the right surgical approach and know which area is entrapped. You can also have the obturator nerve and the femoral nerve compressed, as they lie very close by to the pudendal nerve. Sometimes you can have another separate nerve in addition to the pudendal nerve compressed, such as through scar tissue in more than one area, or you can have a adductor thigh muscle injury, which can possibly compress cause somehow scar tissue or compress your dorsal branch of the pudendal nerve, and other different areas. So it can affect more than one nerve. So it's key to address all possible nerves as a cause of pain, and also all the different muscles involved and areas involved, and the ligaments and also to test for pelvic instability problems, which all these can cause multiple nerve pains. The following are my own opinions for misdiagnosis and underdiagnosis of pudendal neuralgia and pudendal nerve entrapment. Number one, there's very few doctors trained on the actual pudendal nerve and its branches and functions of the nerve, and even fewer are trained in pudendal neuralgia and pudendal nerve entrapment in medical schools, including various specialists such as urologists, gastroenterologists, ER docs, primary care doctors, neurologists, um, neurosurgeons, and more. There needs to be better training for doctors of all specialties on the anatomy of the pudendal nerve and its branches and all the functions of the pudendal nerve branches and the causes and effects of compression of a particular branch of the pudendal nerve. In my opinion, neurologists, neurosurgeons, urologists, gastroenterologists, and other doctors should at least be familiar with pudendal neuralgia, pudendal nerve entrapment, and the pudendal nerve, and consider it as a possible cause of one's problems, especially if all their tests have been done to rule out other causes. Number two, the doctors who are usually trained the most on pudendal nerve entrapment or pudendal neuralgia, at least from my experience, are usually orthopedic doctors and sports medicine doctors or pudendal nerve entrapment specialists, some urologists, and some neurologists, and some other specialties. But because especially the orthopedic doctors, see a lot of it from sports injuries and bicycle riders. Um, Actually, I had to see multiple primary care doctors, about 5 urologists, gastroenterologists, multiple ER doctors, and finally one sports medicine doctor diagnosed me on the spot from the symptoms and exclusion of all other causes. Three, assumption by some doctors that you have prostatitis, even if the prostate test is normal, urologist test is normal, cystoscopy is normal, and everything else. Number four, the tiny pelvis nerves and its branches cannot be easily visualized on most MRIs and cannot always show compression of the nerve, even if there is one. In my experience and others with pudendal nerve entrapment, pudendal neuralgia, one of the best MRIs to help find scar tissue, varices, or other causes of compression of the nerve is with the 3T Tesla MRI. And from my experience and in other patients, the best one right now available is done by Dr. Hollis Potter in New York City. I had an MRI done locally where it showed nothing. Then I got one done by Dr. Potter, and it showed varices bilaterally along the dorsal branch of my pudendal nerve, and also adductor tendinosis. Every time I re-injured my pudendal nerve area, my adductor muscles felt painful. Dr. Potter is one of the top radiologists in the country, and she has her own special software for MRI, and she's been doing this for a long time. A picture with this hard to diagnose condition is worth 1 million words and $1 million to me. Having said that, sometimes here her MRI will not be able to show the compression of scar tissue, about at least half the cases, but those are those odds are still better than none, and better. It's harmless to get an MRI. The technology does still need to be improved for showing these tiny nerves and compression of them. Number five, assumption that you have IC, which is difficult to diagnose in itself, and even those who have a normal cystoscopy are sometimes diagnosed with IC, even though pudendal nerve entrapment or pudendal neuralgia is sometimes the cause. Number six, assumption that you have pelvic floor dysfunction or a bladder problem or a bowel problem after ruling out most of these possible problems and causes with tests such as cystoscopy, endoscopy, colonoscopy, and other tests, and especially if a person has pain in the perineum, that's made worse when sitting and better when standing, using the France non-test criteria, basically. If the patient fits those symptoms, the patient usually gets worse as the day goes on. And if there was a previous injury or a slight trauma or surgery or infection in that area, that can cause scar tissue or other problem, which will cause the compression. Number 7, sometimes people get pudendal neuralgia or pudendal nerve entrapment without any obvious cause, such as trauma or an infection. The reason for this could be anything, but it could be that it has been repeated microtraumas in an area, eventually causing the compression of the nerve. This is just an opinion on this. Number 8, the symptoms of pudendal neuralgia affect many different body functions, sensory functions, and other areas, which can be confusing for certain medical professions and specialties, and can overlap other medical conditions. Some common ways that pudendal neuralgia and pudendal nerve entrapment is diagnosed. One is exclusion of all other causes by specialists and doctors using different tests such as cystoscopy, urinalysis, prostate tests, x-rays, MRIs. Number 2, and other ones as specified by doctors. Number 2, pain is made worse sitting and better by standing or laying down sometimes. Number 3, pain usually gets worse as the day goes on. 4, a CAT scan guided pudendal nerve block, or with women, it's up to the pudendal nerve specialists. I believe some of them may do it unguided, like vaginally for women. It's up to the specialist who's trained and who has experience doing that. Actually, they have to get within 1 millimeter of the pudendal nerve with an anesthetic in order to get close enough to see if the pain goes away. If it does, then the pudendal nerve being compressed or entrapped is a likely cause. Sometimes a CAT scan pudendal nerve block can miss getting close enough to the nerve in order to make the perineum and buttocks nerve numb. In which case the doctor may want to repeat this test to make sure they can get close enough to the nerve. It is important to do this with the CAT scan, at least at this time, to ensure the most accuracy and to avoid nicking the nerve. This is true in my case. 2 or 3 out of the 4 got close enough, but there was at least 1 or 2 where it really didn't get close enough to the nerve. The first nerve block I got gave me complete numbness in my perineum and the buttocks, but especially the last 2 really did not give me get close enough to the nerve to give me that numbness, unfortunately. So it is possible, and I've heard other people where it is possible to not get close enough. Number 5, a pudendal nerve motor latency test, or I believe there's another test called an EMG, some kind of motor sensory testing. Tests have been done by certain trained neurologists or other specialists that can show the motor nerve function has decreased. However, this test is always not reliable, as it only shows the motor function of the nerve and not the sensory function. So if it shows normal motor function, it does not mean that there is not any pain from the sensory part of the nerve. Number 6, physical exam by a trained doctor familiar with pudendal neuralgia, pudendal nerve entrapment. Some common medications for pudendal neuralgia and pudendal nerve entrapment are antidepressants, also muscle relaxers such as diazepam to relax the pelvic floor and nerves of the pelvic floor. Also some other nerve medications, Neurontin, Lyrica, and other ones. Cymbalta, there's multiple ones you can use, which is up to the doctor and they prefer. Some lifestyle changes can make a difference and help avoiding to make your pain worse. Number 1, avoid sitting down as much as possible, and also use a special cushion or pillow for sitting, and instead of standing or laying, try to stand or lay down more instead of sitting. Also avoid lifting heavy things or avoid climbing stairs or hills too much. Um, for most people, walking is okay. Well, it's not up hills. Some possible treatments of pudendal neuralgia depend on the duration of the pudendal nerve entrapment, severity of pain, and the choice of the doctors and the patients for the different causes of compression. Each patient is different, and also the cause of compression is different, so therefore the treatment may be different. Um, one possible solution or option, which some surgeons prefer to be an option after surgery is tried first, is it's called a nerve stimulator implant to help reduce the pain. Another option is called pulsed low radio frequency. Another one is, and the one I just mentioned, the pulsed radio frequency is done at a pain center clinic in California somewhere. There's also another one, I believe, in Michigan. I'm not sure where else. Number three, physical therapy by highly trained physical therapists for this problem. Physiatrists may be able to help. Um, um, Physical therapists may be the first choice and must be done properly. For surgery, this is usually the last option um, after physical therapy, and a certain amount of time passes where things have not improved, and depends on the surgeon and the results of the nerve blocks and what the surgeon says, who specializes in pudendal nerve entrapment. It's usually the last option. It should be taken seriously after all conservative treatments have failed, including hyperavoidance. Um, Number five, Botox is a new type of treatment. The results of this I'm not really sure about. Uh, Other non-medication things that can help some people until the problem resolves, hopefully, um, from you know from physical therapy, surgery, or other, is warm baths. I recommend taking one in the morning and one in the morning and one at night, or heating pads for those who aren't able to take baths, or take a hot shower. Helps to relax the nerves and the muscles and the fascia, all that surrounding the nerves, and it helps decrease your nerve pain also. Ice can also be used for, whenever you have a severe flare or nerve pain. Um, just don't apply it directly to the skin. You can put it in ice cubes in a bag, Ziploc bag, with some water. Can also help. These things can also help reduce the muscle spasms. Other treatments are occasional light walking, um, certain types of physical therapy done by trained physical therapists, such as stretching and myofascial release. Another treatment is avoid constipation and any other urinary problems uh, as much as possible, such as by eating healthy, according to what your doctor says. Another one is changes to your diet, according to what your doctor says, and also avoid stress, which can tighten your pelvic floor muscles, making your problems worse. Another one is hyper avoidance. Avoid sitting or other activities, which can make pains worse. Other things that'll help people. Um, okay, actually, some possible symptoms of pudendal neuralgia, pudendal nerve entrapment, depend on the branch of the nerve affected. Number one is pain in the perineum, the area between just above the anus and the genital area, and between the area just above the anus and right below the genital area or in the genital area. It can be described as a burning, stabbing, knife-like, or other pain. Another possible symptom is urinary frequency, urinary urgency, urinary hesitancy. Another one is erectile dysfunction. Another one is constipation. Number 5, rectal pain. 6, sitting pain. 7, pain in the genital area. 8, painful sex or pain after sex. 9 is hyperarousal. 10, pain made worse bending over or heavy lifting. Another one, 11, is vestibulitis. Other effects of pudendal neuralgia are, number 1, a lot of people over time may have, to go on disability and eventually quit their jobs because of this debilitating thing. Number 2, a lot of them are not unable to drive much at all anymore. 3, they're unable to sit upright without a pillow or special cushion. 4, a lot of them are unable to have sex or have pain after sex or during sex. 5, it usually causes stress and dysfunction, and a lot of the patients have this because of the problems. Because of the stress and dysfunction, it can cause problems in marriages and relationships with partners. Number 6, it can cause financial stress and hardship from having to see multiple doctors and or the loss of your job due to disability or other problems. Number 7, it causes depression from the sudden loss of ability to do many normal things the patient used to be able to do prior to this, including those people of any age, young or old, which can be affected from this. 8, it causes sometimes pain from sleeping if the compression is severe enough or goes on long enough, or pain while sleeping, to become more of a constant pain. 9, affects relationship with friends because they're no longer able to go out and do very much with their friends anymore. Okay, some reasons why there needs to be more doctors aware about pudendal neuralgia and pudendal nerve entrapment, and also why patients and their families need to do all they can to bring awareness to pudendal neuralgia and pudendal nerve entrapment. 1, there's still not enough doctors who understand this pudendal neuralgia and pudendal nerve entrapment. 2, because there's still not enough, because there's still not a lot who understand it. A lot of times, it's very hard, or it takes way too long for the patient to finally get prescribed the right medications, to get finally diagnosed, and to get treated, for their condition, and therefore the patient suffers for a long time without the right medication, treatment, or even diagnosis. There are certain ways that doctors can become more familiar with pudendal neuralgia and pudendal nerve entrapment. 1 is to talk with some of the leading pudendal nerve entrapment specialists, such as Dr. Michael Hebner, Dr. Lee Dellin in Baltimore or Towson, Maryland, who is a world-renowned nerve surgeon at Dellin.com. Another one is Dr. Conway, Dr. Analock, Dr. Rennie, Dr. Ansel, and also Dr. Oscar Osman, who is a world-renowned nerve surgeon. He's actually the first surgeon to attach a robotic arm to an amputated boy's arm. Plastic surgeons are right now probably some of the best at handling the nerves and handling these problems, such as Dr. Dellin and Dr. Osman, because they're trained in it, which is why I wish there was a specialty field in medical school for peripheral nerve surgery, or more plastic surgeons, who are trained in nerve decompression of all areas. Another reason why doctors another way to become more aware is by doctors attending the International Pelvic Pain Society conferences held each year, in which pudendal nerve entrapment is discussed by the leading experts. Number 3 is to learn more through pudendal nerve entrapment surgeon Dr. Lee Dellin's publication found at his website www.dellin.com. After you go there, you can click on Pain Solutions at the top and then download this Chapter 12 publication on pelvic pain for free. 4. Learn more through www.pudendalhope.com and www.tipna.org. 5. Ask P&E surgeon Dr. Michael Hibner for his publication on P&E, which he will give to you or you can download for free on the internet. 6. Go to the International Pelvic Pain Society's meetings or to their website at www.pelvicpain.org. You can call their office also, and you can learn more there if you're a doctor or other through their website or by calling them. Most of the pelvic pain specialists, urologists, and P&E surgeons familiar with this attend these International Pelvic Pain Society meetings and are also members of this group. There's things that things to do emotionally and psychologically that can help you if you're a patient with this. Number 1 is you can think about all the positive things in your life instead of all the things that you're no longer able to do. 2, don't think about those things you're not able to do. Number 3, don't dwell on something that may have caused you to have this, that you may have done physically caused, such as surfing, exercising, or whatever. If you keep dwelling on the past, you won't be able to live in the present or move forward in the future and get this resolved. 4, try not to let your physical problem affect the person who you are inside, no matter how hard it is on your body and life. 5, find new activities, hobbies, or things you can do to replace the ones you can't do anymore, such as writing, playing music, helping others. 6, find people on support groups on the internet, such as the ones mentioned, who understand your problem and what you're going through to help support you. 7, always remember to never give up, stay positive and strong, and remember that there's always hope, and there is help out there, but you may have to look harder to find the right expert or doctor familiar with P&E. Although diagnosis for this is still slow, there are some improvements being made and more awareness about P&E each day, and more surgeons and surgical improvements than there was even 10 or 20 years ago. However, having said that, there still needs to be more improvements, especially in the area of the dorsal and perineal branches, which most surgeons for P&E, except for one in the U.S., cannot do right now. Only Dr. Dellin is able to do that. I don't understand why there's not more, but right now there's only one, Dr. Dellin, who can do some major branches of this pudendal nerve decompression. The other ones right now mainly can just do the TG, but that cannot access 3 major areas of the nerve: the dorsal, the perineal branch, and the distal Alcock's canal. So this definitely needs to be looked into by other P&E surgeons who are just doing the TG approach, or possibly others, plastic surgeons, if they were willing to help us out. Number 8, I know people who have been cured or greatly helped after having this problem for over 30 years, and a lot who have had it for 3 years or less. So there is always hope. You can get better with the correct diagnosis, the correct pinpointing of the branch of the nerve being compressed, and by seeing the right doctors and P&E specialists, physical therapists, or surgeons. It also can take a while sometimes for nerves to heal, so there is hope. It may sometimes get better, especially if you have not had it long. Okay, there are ways that patients, families, and friends of patients and doctors can spread awareness about P&E. If you're a member of Facebook, you can add a Fight P&E badge to your profile picture by going to www.pickbadges.com /pudendal-nerve-entrapment. or you can do a search for it there, and you can add this to your profile picture. 2, you can tell your friends and family members to show their support for you and to bring awareness to P&E by adding the Fight P&E badge to their profile pics. 3, you can email or call any past doctor or specialists who have treated you in the past to let them know that you were finally diagnosed with P&E and maybe to let them know more about it. 4, regularly go to support websites and forums for patients who have P&E at pudendalhope.com and tipma.org. And also interact with people who have your problem. You'll also learn about this as I have by talking with other patients, because a lot of them have already had surgeries or seen some of these P&E specialists. 5, if you know people in the medical profession, especially your own family members, or if you are a doctor or a surgeon, please tell everyone you can about this extremely underdiagnosed and misdiagnosed nerve compression problem in the pelvis called P&E, and explain it to them, or email them the links listed for the doctors above, or any other information you can which explains this to them. 6, get a clear window decal made that says Pudendal Neuralgia Awareness, or you can get one that says pudendalhope.com or .org, pudendalhope.org. 7, brainstorm with friends and family members of a support group about ways to bring awareness and think outside of the box and find how to find ways. 8, start a blog about P&E. 9, write an ebook or any other book about P&E on Amazon Kindle. You can publish your own Amazon Kindle ebook for free there and talk about your experience. 10, don't keep it a secret. Don't be ashamed about your problem, but try to open up and tell people about it and explain it to spread awareness, because if you don't tell people, if you keep it not in the public and not in the open, then it's not spreading awareness and it's not helping you and others out. 11, talk with professors in medical schools about this problem, or other doctors you may know, and email them information on it and ask if they'd be willing to learn about this and to teach about this in the medical condition at medical schools in more detail. Okay, this is just my own personal opinion, but I think that there definitely needs to be more rigorous study of the pudendal nerve and other nerves in medical schools, and not less. Especially for those studying to be surgeons, and especially those who are studying to be plastic surgeons who are dealing with tiny nerves. I would say this: if you're thinking about being a plastic surgeon, consider using those skills maybe instead of for cosmetic reasons, but for reasons to help people who have severe nerve compression problems. And right now, plastic surgeons are best trained right now on how to decompress and deal with these tiny nerves in the body. I also think it would be a good idea to actually have a surgery specialty in medical schools called peripheral nerve surgeon, who are specifically trained to do surgery for decompression and handling nerves and other surgeries of all types of peripheral nerves in the body. These tiny peripheral nerves. Today it seems as if plastic surgeons are the best trained how to do this. My question is, why not make this new specialty called peripheral nerve surgery? There are neurosurgeons, but they rarely deal with nerves outside the brain and central nervous system, especially these tiny nerves in the pelvis or others. There are general surgeons. There are many different kinds of surgeons, but why is there not a specialty field for peripheral nerve surgery? It makes sense to me, and it more accurately describes what plastic surgeons who currently do these P&E surgeries for peripheral nerves actually do. Also, I strongly feel that urologists should be trained in medical schools on all the nerves in the pelvis, because very few of them in the world are familiar with the pudendal nerve, which affects so many organs in the urinary system and functions of the urinary and reproductive system. which is what I thought urologists were supposed to be trained on. I would not expect a podiatrist, a foot doctor, to be trained on the nerves that affect the urinary system, but I would expect all the urologists to be trained on the nerves that can affect the urinary system, uh, which is the pudendal nerve is the main one in there. There also needs to be more surgeons in the U.S. who are capable of and familiar with surgery to decompress the pudendal nerve, just as there are for other nerves such as carpal tunnel syndrome, trigeminal neuralgia, tarsal tunnel syndrome. The most important area of the pudendal nerve, which there needs to be more surgeons for, is the dorsal branch and the perineal branch and the distal alcox canal of the pudendal nerve, which, as I mentioned, currently only one surgeon in the U.S. is able to do. So somebody needs to learn how to do it from this surgeon, Dr. Lee Dellen, or go to Dr. Oscar Osman in Austria, a world-renowned surgeon, to learn how to do this surgery for the sake of, and benefit of helping many, many, many people with this underdiagnosed and hard-to-treat problem. And people have been helped by these two, by the way, in these two branches. The only other current, okay, America needs more surgeons trained in this area, basically, to handle these nerves. There's a vast shortage of surgeons capable of handling and decompressing nerves in the pelvis and the perineum, especially in the dorsal perineal branches. When physical therapy fails and a nerve is compressed in this area, and it's been a while, and especially if the cause is from scar tissue or other source, surgery can cure or greatly take away a person's daily debilitating pain from this. This is why we need more awareness from the entire medical profession, the entire public, because the quicker it's diagnosed, the quicker it's treated, in all different ways of medication and or surgery or physical therapy, the better for the patient. It has gone on way too long as being called idiopathic, which means unknown cause, idiopathic pains, unknown pains. This is not an idiopathic medical problem. Idiopathic means unknown cause. There is a cause. It's not idiopathic. What I'm trying to say is, please, just do not always call it idiopathic, but know that there is a cause. And in too many cases, the cause is a nerve which needs to be decompressed, or the source of the compression needs to be treated in some way. Most of chronic non-bacterial prostatitis is from a neurological or muscular problem or both, which is why most of the time cystoscopies are normal, prostate secretions are normal, digital rectal exams are normal, prostate ultrasounds are normal, and antibiotics don't work. Because it's not the prostate that's the problem in the majority of these cases, but it's the pudendal nerve that is the problem in many of these cases in some way. There are lists of doctors and surgeons who can help with diagnosis and treatment of P&E. For complete list, you can go to pudendalhope.com or tipna.org, or you can also go to pudendalhope.org. You may also be able to find a specialist such as a sports medicine doctor, orthopedic doctor, physiatrist, urologist, neurologist who's familiar with it. But first you need to call their office to see if there is one there who's trained on diagnosing or treating P&E. You can also go to a website to find a sports medicine doctor in your area. They can usually diagnose it with the pudendal nerve block CAT scan guided one in your area most of the time. You can also go to www.amssm.org, and then you can find a doctor in your area, but you would need to call their office to make sure that they have one familiar with it. Sports medicine doctors, orthopedic doctors are also highly trained on recognizing and treating P&E, which is how I was, and other ones. They can also find other problems that may mimic or cause P&E, such as SIJD and piriformis syndrome. lower back problems, etc. Um, they're sometimes the best, besides the P&E specialist, to at least get you the diagnosis and some kind of treatment started, and to schedule a pudendal nerve block for you. You can also call 913-327-1415 to find one in your area. One thing also I'd just like to say is, for anybody interested in really helping patients with this, I think, in my opinion, one of the leading uh, promising surgeons, a world-renowned surgeon who used to work with at Johns Hopkins University or Hospital with Dr. Lee Dellen, is Dr. Oscar Osman in Austria. If you are a plastic surgeon or a peripheral nerve surgeon in the United States, and you would like to actually learn how to do this surgery, which we really need here in America, there's many people I can refer to you, including myself, to learn this approach for the benefit of all humanity. I suggest you please contact him. The surgical approach is called the anterior pubic ramus approach that Dr. Lee Dellen also does. We need more surgeons in the U.S. to learn how to do this from either one of these two surgeons. There is a great need for people to have this surgery. There are many people who have had a nerve compression in this area of the pudendal nerve for years, and in which physical therapy has not helped them, and surgery is their only last option. This area of the pudendal nerve is a very large area and important area in which people can have a nerve compression, and I know people with this branch of this pudendal nerve compressed, including myself. I'm asking all surgeons to please learn how to do this. If you learn this surgery, you will be providing a great need for humanity and be of great help for everyone with pudendal nerve entrapment. Please help us, because this part of the human body is very painful and very sensitive and affects so many areas of our lives. We cannot sit. We cannot have sexual relations with our wives or partners anymore. We cannot work in some cases because of the pain and the medication. We cannot do many of the things, the basic things that we used to be able to. We have a very poor quality of life because of the severity of the pain and the disability that results in this nerve compression. Some people have committed suicide because of this severity, the pain and the problems. A lot of marriages have been torn apart from this. Mom and dads can no longer work to support their family and their children because of this. Moms and dads can no longer drive their kids places anymore because of this. Some people have so much pain from all this that all they can do is lay on their back or in their stomach in extreme pain from this all day. I never knew what pain really was in my whole life until I got this constant, severe, debilitating pain in this area of my body. That I have come to find out that not only I, but many other people have. The problem is that this is not a rare medical condition, but rather it is a misdiagnosed, misunderstood, underdiagnosed, and mistreated problem. Some of my opinions for reasons for low surgery success rate are: one, in order for surgery for P&E to be more successful, it is first very important to pinpoint the exact branch of the pudendal nerve that is being compressed, and to get the correct surgical approach for that area which can access that branch of the nerve. There's different surgical approaches that can access only certain parts or branches of the pudendal nerve, and not all of them. There's the TG approach, which can access some of them, but not all of them. The other main area that I was talking about is the dorsal and perineal branch and the distal Alcock's canal, which can only be done currently with the anterior pubic ramus approach, done by only Dr. Lee Dellen and only Dr. Oscar Osman in Austria at this time. We need more surgeons for this area. These surgeons can decompress these branches if your symptoms are in these areas of the perineal and the dorsal branch of the pudendal nerve, um, you usually sometimes have some general pain. You may have some urinary problems, and may not have any constipation. Um, Anyways, I would suggest to make an appointment with Dr. Lee Dellin in Baltimore, or you can email Dr. Oscar Osmond or contact him. Um, they both used to work at Johns Hopkins Hospital, a top hospital in America. Dr. Osmond speaks perfect English, and you can email him at oscar.osmond at meduniwien.ac.at. That's oskar.aszmann at meduniwien.ac.at. Three, there's very few surgeons in the world that can do decompression of the pudendal nerve and the remaining branches of the pudendal nerve, which I just mentioned. Four, it's hard to pinpoint sometimes the exact locations of the or branch of the pudendal nerve causing the entrapment or compression, because the symptoms of entrapment in one area of the pudendal nerve can overlap symptoms of a compression in another area. For instance, compression of the dorsal branch, perineal branch, distal Alcock's canal of the pudendal nerve can be similar to the same symptoms of compression of the pudendal nerve at another location in the pudendal nerve. And sometimes there may be a compression of the pudendal nerve at more than one branch of the pudendal nerve, such as the dorsal and the rectal branch, which may require two different surgeries to decompress both of these areas, which Dr. Dellin stated in his publication. And I've known personally patients who have had to have multiple surgeries because of this also. Whatever initial injury caused your problem can cause pain, compression in more than one branch. 5. Sometimes there are other causes of compression of the pudendal nerve instead of the most common ones found in surgery. These other possible causes are sacroiliac joint dysfunction, pelvic instability, piriformis muscle syndrome, and more. 6. Most patients who have P&E in the area reached by TG approach or TIR approach are usually told they will have a success rate of 40 to 50% improvement and not a total cure. However, patients with P&E in the area of the dorsal branch, perineal branches, are usually told they have a higher success rate of improvement, about 80%. 7. The pelvis has a large amount of different nerves from different origins that can make sometimes a diagnosis complex or hard for doctors, especially ones not trained on P&E. There's been no studies on why the difference of success rates in surgeries for TG approach versus the dorsal pubic ramus approach is given, but there's some opinions on why this may be. If you have symptoms that indicate you're entrapped in your rectal branch between the SS and ST ligaments or Alcock's canal, you could actually either have a compression in the area of your perineal branch of the pudendal nerve and the dorsal branch, or just one of these areas instead. It may sometimes be more difficult to distinguish between if you are entrapped in these areas compared to just having a compression of the dorsal perineal branches, which may not cause rectal pain and constipation, but just urinary problems, ED, genital pain, or pain in the superficial area, the deep area of the perineum, where the perineal branch of the pudendal nerves are innervated and affects. 2. For the dorsal and perineal branch surgical decompression, there is no cutting of the sacrotuberous or sacrospinous ligaments, and usually there's a less time involved, and it's a quicker recovery time, and there may possibly be less chance of developing scar tissue because of these things. Um, Please remember that any advice that I've given on this video does not substitute for the professional advice of a doctor. Always seek out the advice of a trained physician regarding any uh, medical problems you may have, or any advice, any symptoms you have, and before making any changes in lifestyle. For all of those with P&E out there or Pudendal Neuralgia, I made this for you and all of us, your loved ones, and for those who may get this in the future, because I know from personal experience how hard and debilitating this is, and how it affects every area of your life, and how sometimes it seems as if it is so hard to find a doctor, or even a family member, or even a friend who understands what we have. But keep in mind that you are not alone, and there is always hope. I want to thank all of the P&E doctors, all of the support groups, all of my P&E friends for the support, and especially a brave fellow friend of mine with P&E who was just recently, very recently decompressed by surgery um, in the dorsal and peroneal branches of the pudendal nerve um, by Dr. Oscar Osman in Austria recently, where he did find a huge mass of scar tissue that he called a glob that was trapping the nerve at the distal Alcox canal. And this glob contained many sprouts of tiny branches that were trying to regenerate after the initial injury, which was over 2 years ago, maybe 3 years ago. He had to remove that whole glob of scar tissue, and he freed up the peroneal branches and decompressed the nerves. And now my friend is on the road to recovery and healing. In the words of my fellow friend who has inspired many of us, if not all of us with P&E even more, by being brave and giving us so much advice as well as more hope. Fight P&E.